This pandemic has turned our lives upside down, and children are not spared. Between online learning and canceled playdates, the routines are anything but routine. Staying at home may keep them away from COVID-19, but that doesn't mean it's totally risk-free. There are also instances in which children can face some health risks, especially when they're unsupervised. Children are most especially vulnerable to airway obstructions. Anything from coins, small toys, food particles, and other small items at home may cause this. And the result is breathing or airway compromise, choking, and the worst case, of course, is accidental death. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. We're here to build a healthier future for you. Anything that compromises the airway can be life-threatening emergencies that may need immediate medical attention. And knowing how to prevent this can spell the difference between life and death. To help us with today's discussion, let's welcome our guests who are both pediatric ENT specialists. Joining us is Dr. ADONIS JURADO. He's the president of the Philippine Academy of Pediatric Otolaryngology. Also with us is Dr. Lyra Veloro. She is the head of the Pediatric Otolaryngology section at the Medical City. Airways, or pathways where air flows into your lungs, are a lot different or smaller in children, making them more vulnerable to obstruction. So anything that can get caught in there could be a potential problem. And knowing and understanding how the body works can help you recognize, prevent, and even respond to a choking emergency. Dr. Jurado, I'd like to start. Let's take a quick anatomy lesson kung bakit ang mga bata ang more vulnerable to airway obstructions as opposed to adults. Siyempre, we know that the children are physically smaller, but let's talk about where these obstructions can happen in a child.
More often than not, because these are food particles. And the most common food that causes obstruction actually are peanuts. Because the child don't have second molars and therefore they have poor grinding abilities. So the tendency is for the nuts to be swallowed whole or aspirated whole. And this can obstruct either the left main bronchus or the right main bronchus. Rarely does it obstruct the trachea.
But it can also obstruct the passageway of food. Does that happen often as well, wherein there's an obstruction in the esophagus?
Usually, the most common are coins, especially if there are inadequate supervision. People sometimes leave small things, small objects within the reach of the baby.
Now, I'd like to ask Dr. Lyra, what are some of the most common objects at home that our viewers should know about that kids usually like to put in their mouth that can cause them to choke?
There are objects that commonly causes choking in children that are present at home are mainly food items. But there are also non-food items that are present in our household that can pose a choking risk to children. And these include the batteries, the small batteries, small toy parts. These are items in the household that should be kept away from children because it poses a high risk of choking-related injuries.
Batteries that are disc in shape, the small batteries that may be found in mini laser pointers or maybe watches. Could you explain why there's a higher risk for this type of object that when it gets lodged to maybe the nose or maybe the mouth, that it could cause further damage that may be unknown to the caregiver or to the parent?
Batteries actually, when ingested or aspirated, is more hazardous because they contain chemicals inside that could seep out and damage the tissues surrounding the tissues where it is lodged and causing more damage than what is normally seen in objects that do not have these chemicals.
Dr. Lyra, ano ba usually yung mga dapat bigyan pansin ng mga parents or caregivers sa mga bata when it comes to the food? What type of size of food is best? What is the consistency of the food?
There are types of food that should be given children that should be appropriate for their age. For example, you should avoid giving children less than 3 years old certain foods, for example, under the vegetable or fruit category. You avoid giving them dried fruits, raisins, pieces of carrots, peas, because they have incomplete dentition. Their molars have not yet developed, and they could not grind their food well. So the danger of aspirating it whole is there.
Now, Dr. Jurado, speaking of food, when it comes to the studies kung kailan nag-choke ang isang child or pag may nag-aspirate, it's during kapag sila ay kumakain at naglalaro or gumagalaw at the same time. Could you talk more about this?
Based on our experience is we have a lot of what we call unsupervised feeding. Pinapabayaan mo lang yung bata, or sometimes older children feeds the younger child with whatever objects.
Dr. Jurado, let's discuss some of the symptoms. Ano ba yung nakikita sa isang bata kapag siya ay may airway compromise na or nag-choke?
Sudden dyspnea is in 50% of cases. And then the second most common is coughing. The third most common is nangingitim, cyanosis. And the fourth most common is choking while feeding.
What is the most important tool that a doctor can have, Dr. Lyra, when it comes to assessing the cause of any obstruction? Is it mainly the imaging modalities at hand, or is it the information of the caregiver or the parent?
So when the child with suspected airway foreign body is brought to the emergency department, usually the child is immediately assessed by an experienced doctor. So it's really a combination of good history taking, complete physical examination with the aid of imaging, and also the recognizing or determining the need for a bronchoscopic procedure already.
Now, when we return, we'll talk more about why children are the most at risk for airway obstruction. We're your connection to healthcare. You're watching MedTalk Health Talk on CNN Philippines. Small children from ages 0 to 10 are naturally curious and explore their environment by placing objects in their mouths, their ears, their noses. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Dr. Lyra, what are some of the factors involved here aside from unsupervised children? What are some of the factors that increase the likelihood of a child having a choking episode or airway compromise?
So it's very different in children because anatomically, the airway is already small and narrow. So if you add to it an obstructive condition, whether inflammation or a foreign object, then the risk is higher for children.
Dr. Jurado, from breathing difficulty to choking, how much time do we really have to make sure this obstruction is out of the way?
Whether it's a complete obstruction or partial obstruction. But we're talking about partial obstruction. It could last a few hours or a few days and even years.
What would be the best first aid for a child who they assess is indeed choking or has their airway blocked?
What we call the Heimlich maneuver or the chest tap maneuver in younger children, or the Heimlich maneuver is the abdominal thrust, wherein you put your two hands in the abdomen of the child and push up. Whereas the chest tap usually is used in babies, younger children, or babies, wherein you put the child head down and then put the tap on the back of the baby. In younger children, 1 year old below or probably 2 years old, you can do that depending on the size of the child. So normally the Heimlich maneuver is done in the older children.
But there are some children who may be sleeping who snore. Maybe the parent or the guardian will be able to hear this. Would this be a cause for concern? Would they think that this would be a blockage? How would they be able to assess if the obstruction is something of an emergency or something that is physiologic with a child?
To actually determine if the noisy breathing is an urgent condition or not. So my advice would be, in children with noisy breathing, they should bring that child to the doctor for assessment, because that's the only way they could be reassured that if it is a non-life-threatening condition, then they can be reassured as long as the patient is already seen by the doctor.
When it comes to foreign body sa ear, mahilig din ng bata maglagay ng mga bagay-bagay sa loob ng tenga nila. Are there certain symptoms that a parent or guardian will be able to pick up on, thinking that there is a foreign body in the child's ear?
If the foreign body does not react much with the surrounding tissue, sometimes it stays there for a long time, ranging from days to several months. If the foreign body is organic and it decays or it absorbs water, then it can produce a foul smell or it can produce a discharge. Then the foreign body will be able to manifest itself. But in the nose, it's easier to detect because the mucosa of the nose is not naturally moist. So if there's a foreign body there, within days you will be able to smell it, and you will be able to see unilateral discharge from one of the nasal cavities. There will be discharge in one of the nasal cavities, and the smell is really very foul. So those are the signs that would tell you that there's a foreign body either inside the nose or inside the ear.
Now, when we return, we'll talk about what to do when your child's airway becomes blocked or obstructed by a foreign object. Your health is our mission. This is MedTalk Health Talk on CNN Philippines. Watch out for any foul-smelling nasal or ear discharge, noisy breathing, coughing, or wheezing. These things can be indicators that the airways have been obstructed. Now, children, of course, are most vulnerable. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care always comes first. Dr. Jurado, aside from the Heimlich maneuver and back blows, what procedures are best done when the child is being treated?
At home, those are the only maneuvers that I know that can be performed by the caregiver or the parents. But the most important is that they should seek immediate treatment when those symptoms appear.
Okay, now Dr. Jurado, let's talk about an emergency procedure that could most likely save the life of a child if the airway compromise is definitely complete, and that is an emergency cricothyrotomy. Could you discuss about this and how this could potentially save the life of a child?
You put both hands on the abdomen and then your arms around the abdomen, and then you thrust. They call it the abdominal thrust. The other one is the chest tap or the back tap that you tap on the back. Those are the only two maneuvers that probably could be done by the people at home.
Dr. Lyra, what should we do or not do? Let's start with the don'ts muna. What shouldn't the parent or guardian do that may aggravate or make the problem even worse?
The adults who are present or the caregiver's initial reaction is to attempt to remove the foreign body by blind finger sweeping. Unfortunately, this maneuver can cause trauma and can cause bleeding, and may push the foreign body further down into the airway and potentially completely obstruct the airway. So blind finger sweeping should not be done in infants and children with foreign body obstruction. I would suggest that child care providers like teachers or parents should take classes on resuscitation, age-appropriate choking, first aid maneuvers in order to be able to execute the needed intervention safely and correctly. What they should do in cases of foreign body aspiration is to bring the child immediately to the hospital.
Parents or guardians may want to remove that foreign object there. It may be impacted cerumen, earwax. What should be the proper way to clean a child's ear? Or should the parent or guardian even do so?
Actually, the ear has a self-cleaning mechanism. Normally, the wax comes out on its own eventually. Only in children, since the canal is very small, it's still very small, the buildup of wax inside the ears is faster than it coming out. So in children maybe below 5 years old, there should be regular cleaning by the ENT. I do not advise them to attempt to clean inside the canal themselves because they might traumatize the ear canal and make things much worse.
Now, Dr. Jurado, when it comes to obstructions in the airway or the esophagus, are there certain symptoms that may prompt the parent or guardian that one area is probably blocked as opposed to the other?
Normally, you would have difficulty in feeding the child, and the most common symptom is vomiting, whatever food intake they have, because it could not pass through to the stomach. And normally, the blockage of the esophagus is usually in the upper esophagus.
Now, Dr. Jurado, kapag natinik ang isang bata, kumain ng isda na may tinik, na may fishbone, what is the proper way, what is the proper thing for the parent or the guardian to do?
Normally, I think you should be feeding the child with a fillet, or the chicken probably should be devoid of bone in young children.
You would advise seeing a doctor immediately and not try and dislodge any fish bone or chicken bone with swallowing bananas, drinking lots of water. Proceed right away to the emergency department.
Tendency is probably kung nakatusok na siya, baka lalo pang mabaon. So, I think it's better to seek professional help rather than do those things.
Okay, so you heard it from the experts. To our viewers, do not try and dislodge that fish bone or chicken bone by eating more food, for that matter. Thank you, Pediatric ENT specialists Dr. Adonis Jurado and Dr. Lyra Veloro, for sharing your expertise with us. It was really good speaking to you both. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines.